Lawin Media Network.
Bringing to you the most relevant content across all platforms.
Business, legal, politics, health, lifestyle, and entertainment.
Your source for all the news and updates in the greater Houston community from Texas and all over the world.
Get informed and empowered with Lawin Media Network.
Good evening, everybody, and welcome to Pink Table Talk. I'm your host, Dr. Carly D., a doctorally prepared nurse, educator, professional development specialist, mentor, and victims advocate and thriver. The show is produced by Lawin Media Network, and you can catch us live every Wednesday at 7 o'clock Central, 8 o'clock Eastern, either through our YouTube Live, Facebook Live, Twitch TV, and on all podcast platforms, including Apple, Spotify, Amazon, and Google. Tonight, we have a special episode where we're going to be discussing men's health and men in nursing. Joining us tonight will be Professor Ed Davis, who's an associate professor at Chamberlain University. He is also pursuing his doctorate of nursing practice at Chamberlain and is expected to graduate in 2027. He is bringing with him tonight two decades worth of nursing experience and academia experience. So I would love everybody to welcome to the show, Professor Davis.
Good evening, everyone. How are y'all doing today?
Good evening, good evening. How are you doing tonight, Professor Davis?
I can't complain. It's like a pretty nice time here in Houston. The weather is actually cooperating for once.
Yes, I know. It's been cold the past 2 days in the 50s, and now we're back in the 80s.
Yep.
Yes, so pretty typical for the erratic Houston weather.
Yep. Give Texas 5 minutes, it'll change its mind in no time.
Yes, so true. And so for our audience watching, Professor Davis, can you tell us a little bit about yourself, your background, and what made you go into nursing?
Sure, not a problem. I've been a nurse going on about 20 years. It's like I've done med-surg, I've done home health, hospice, managed care, disease management, and most recently academia. My track to nursing is not your traditional one. I didn't start off wanting to become a nurse. I actually started off wanting to go to med school. From there, it's like my dad got sick and I kind of changed directions in terms of medicine wasn't where I wanted to go. I actually kind of enjoyed taking care of people. And my mom mentioned, hey, you got a family full of nurses. I'm one. It's like my sister's one, a whole lot of other people. My dad, he was in the Army. He also was in the medical field. So basically, it's like that was an easy transition and haven't looked back since.
Wonderful, wonderful. We haven't had too many male guests on the show. We mostly feature a lot of women's on the show, women professionals, entrepreneurs. So I'm delighted to have you on the show tonight to give us a different perspective. And so talking about your career in nursing, there's not a lot of men in nursing, and I know that you're advisor for a group on the Chamberlain campus called Men in Nursing. Can you tell us about that and what it's like being a male in a mostly female-dominated field?
Well, I would definitely say when I got into nursing, I was the oddball of the group. I would say it's like when I graduated from San Antonio College with my nursing degree, it's like I was maybe out of 80 nursing students, maybe 5 of us, and I'm being quite modest here. Not modest. It's like I'm leaning pretty heavy on that 5. I probably say a little less than that. And it definitely showed in the attitudes and viewpoints that I got from not only it's like peers, but from the general public. They actually did not think it's like men really needed to be in nursing. And it wasn't until it's like you actually start doing the job that they're like, oh, hold up, you might actually know what he's talking about. So
Yes.
after a while, it's like they're kind of like, you might want to be a role model for some other people coming in behind you. So a couple schools later, they were like, hey, why don't you start leading a men's group? So Chamberlain worked with me in terms of developing the men in nursing student organization, which we kind of act as an advocacy in terms of talking to other male nurses in the field, mostly working on the floor in terms of kind of getting their perspective in terms of communication, interaction, what to do, what to look out for in terms of getting you ready to actually work on the floor.
Yes. And what did that look like? What did that preparation for male nurses versus female look like? Was there any differences at all?
It's like for some, yeah, it's not really a whole lot. It's just kind of more words of advice. It's like
Yeah.
the care for someone is going to be the same no matter if you're a man or a woman. But
Mhm.
when it comes to a male, a couple things do kind of stick out. Some departments are going to be more welcoming to men versus women. Particularly those are going to be like L&D, labor and
Yeah.
delivery, women's health. It's like usually just like most people really don't want a man looking down there for the most part. They don't want to look down there for the most part. So it's like we usually try to stay away from those. And it also suffers from the same issue that men in general are dealing with. And that's that viewpoint of masculinity. Nobody wants to say it's like, hey, I'm a male nurse working in a female dominated industry. I don't want to look soft. So a lot of male nurses actually gravitate toward very specific fields like ortho, the
Yes.
ER, critical
Yeah.
care, the TV show nurse, where it seems like, hey, I'm coming in and I'm saving the day.
Yes, I find that to be true as well throughout my career in nursing. I do see more male nurses going into like sports medicine, ortho areas, rehab,
Yep.
definitely ER and ICU for sure.
Mhm.
Absolutely, absolutely. And so you have received multiple eye care awards, recognizing your excellent student engagement, working well with coworkers. So talk to us about that.
Well, I mean, it's pretty easy. It's like I always go from the viewpoint of treat people the way you want to be treated. It's like if you go in and you want to kind of act like, and I should give the same advice to my brand new nurses, don't walk into the floor thinking you are God's gift to nursing. You're going to get clowned very badly, especially from the non-nurses. Go in with an attitude of understanding, asking questions, and wanting to learn how to do the job. Don't think you know how to do the job. And you're going to get a whole lot more respect in terms of actually advancing in a career.
Yes, very true. And for those students that you mentor, what words of wisdom and advice do you find yourself giving them for this current time and age in the state of nursing as it is now?
It actually really depends on what they want to do. It's like one of the big things I always tell them, look, you can't really worry about the future when it comes to getting through nursing school. You actually need to graduate first. And that's one of the things I kind of encourage, like, hey, it's great to get a job. It's great to work in the field and gain that experience. But I kind of need you to concentrate on the classes and actually passing those. And some of them get it, and other ones are kind of like, well, I'm going to work 40 hours. And I'm kind of like, you're spending an ungodly amount of money coming to this school and getting your degree. You might want to kind of scale back some of that time and actually focus in on your classes. And they take it to heart, and other ones not so much. But we work with those in terms of it's like courses, getting them prepared for the NCLEX, and getting them out the door.
Yes. Yeah, it's so true. I do find that students are often in a rush to kind of finish and they only see the finish line. They look at social media, they see the nurses who are working and they're shopping and traveling. And so that's kind of what their mind is at. And so they're not always focused on actually going through the process, actually experiencing the journey of nursing school.
Yes, that is one of my common conversations I have with both the older nurses and the brand new nurses that are in our beginning programs. Hey, the image that you have of nurses that are on TikTok, TV shows, and a whole litany of other things really is a very rose-colored perspectives. It's like, yes, it's like the Grey's Anatomy where it's like everybody's messing around with everybody else. Yes, there is that, but it's not as pronounced as the TV shows feel. It's like there's not nurses that are literally verbally and physically attacking their other co-workers in terms of making their point. It's like there's not background music playing, and it's like there's gunshot wounds running in and out the door every 5 minutes and explosions everywhere. It can be very boring, but it can also be very rewarding. But you need to really think about if you really want to do this. It's like a lot of times I see a lot of student nurses going into the field thinking, I'm going to get paid. And I usually give a very sobering conversation of, no, that's not the case. Eventually, yeah, it's like the money is good, but as a brand new nurse, the money isn't that good. And it's going to be very stressful.
Yes, absolutely. I know for myself too, when I first started as a nurse, we think of job stability, we think of financial security, but that first year is rough.
Yeah.
It's very hard, and it really, I would have to say it breaks you down, mind, body, and soul until you finally come to find your comfort level in nursing and build that confidence. But, you go through the ebbs and flows, you go through that honeymoon phase in the beginning, you're so happy to be on the unit, you got your badge, you get your first paycheck, you're so happy, like, ooh, I see all these zeros, and then you get a few weeks in and it's like, uh-oh, what is this all about? Did I make the right career choice? Am I doing the right thing? And so it does take that year, to go through that journey.
And it's true. It's like one of the things that it's like when I'm teaching health assessment, one of the first conversations I ask is, why are you here? Followed then by, after you tell me why you're here, I'm going to tell you 2 things that are going to happen to you after it's like you graduate. One, for your first year, you're going to feel like you're going to kill somebody. You're not going to kill nobody, but you're going to feel it for a good year. That the patient's going to cough and they're going to code on you. And I'm like, that's not the case. There is a whole lot of people working to help with you. And you're also going to want to cry. And I say this to both my men and female students, because a lot of times it's like women are a lot more in touch with their feelings and, hey, the anxiety, the stress, and basically needing, hey, I need a chance to break. For my male students, it's a little bit more of a, nah, I'm not going to show any weakness and I'm not going to cry. And I'm like, yeah, you're going to cry. And I can tell you now, it's like as a male nurse, there's going to be somebody that's going to make you cry. It's like they're going to sit there and wait for you to cry, even when you don't want to.
So true. I love this fresh perspective. I love this topic and discussing it. But we're going to go to our first commercial break of the evening. But everybody stay tuned for more Pink Table Talk with Professor Davis.
In a world filled with fleeting moments, there's beauty waiting to be captured. My name is Christian, and I specialize in immortalizing your most precious memories. From elegant weddings to vibrant events and timeless portraits, I'm here to make every moment unforgettable. Let me tell your story through the lens. Contact me today and let's create magic together.
Welcome back, everybody, to Pink Table Talk. Tonight, we're talking with Professor Ed Davis, and we're talking about men in nursing and men's health for International Men's Health Month of November. So before we went on the break, we talked about his background, how he got started in men's health and with nursing, and how he helps to mentor new male nurses going into the field. So, Professor Davis, I see here that you won a distinguished award and was awarded by the White House for your work during Hurricane Katrina and some of the natural disasters that we had here in Houston. Talk to us about that, and how did it feel to win that award?
Just like everything else in terms of my nursing career, I kind of just walked into it. I literally had just graduated nursing school, and at the time I was actually volunteering at the Red Cross in terms of the local chapter in San Antonio in terms of just responses and helping out. And then we found out about Hurricane Rita and Katrina. So I'm sitting here, I'm on the phones, and it's like helping people try to connect and try to find people and trying to direct them towards the different shelters and the operations phone numbers and whatnot. And the field commander, it's like he heard me say, it's like to one of my coworkers, yeah, I just graduated nursing school. And he kind of paused and turned and looked at me. It's like, did you just say you graduated? I was like, yeah. Why? Come with me. And from there, it just started rolling. So I helped in terms of establishing a couple shelters in the San Antonio area, knowing a few friends. I happen to know other friends, and we worked in terms of actually getting with Whataburger and getting about 50,000 meals for the incoming people coming in that were being evacuated from New Orleans. They got moved to, it's like Baton Rouge, and then got on C5s and headed toward Joint Base Kelly Air Force Base.
Wow. Wow.
And I worked on that for about a year in terms of volunteering, helping out, coordinating with community resources. One of the big things I did was actually contacting a lot of the religious groups for all the different denominations that were in New Orleans. So Christian, Islam, Buddhists, everybody, in terms of finding them a room for religion, setting up power conduits, setting up plumbing, decontamination centers, and a number of different things.
Wow, that's amazing. Thank you for your work during those disasters. I know that must have been very stressful times. Did you feel prepared as a nurse to help out in those situations?
I did. Actually, it's like when it comes to the care and whatnot, you're doing a lot more triage when it comes to disaster nursing in terms of you're doing care, but it's very immediate. Like you're stabilizing the person and you're shipping them off wherever they need to. It's not to the extreme that you will learn in nursing school where you're putting red marks or black marks on people's foreheads, say they're dead or alive, or we don't need to give care, we do need to give care. You're doing a lot more. It's like, hey, this person's having shortness of breath and they don't have their medications. Let's get them on an ambulance to one of the local hospitals that can actually help them out. Or it's like just talking to somebody in terms of dealing with their anxiety, calming them down so they don't run into a panic attack.
Yes, very good, very nice. Yes, I do. I worked in public health for many years, and then I was also on site during the COVID crisis, and that kind of came to us by surprise, and I feel that we were not really prepared to handle such a large crisis. But we were all very willing to just kind of jump in and help. And I think that goes to the spirit of nursing, is that, we're going to answer the call, when these disasters or crises happen. I feel that we're ready to be on the front lines and ready to help people. It's very
I completely agree. When the COVID response, I knew a lot of people that basically left the hospital, went to a traveler position because they were getting paid very well. But I didn't want to do that. I actually wanted to help. So one of the things that I did in COVID was I do COVID testing and vaccinations for it's like the local power company. Because what a lot of people don't think, well, what happens in a pandemic if the power goes out? You need line workers. It's like you need administration. to keep the lights on. So my job was keep them sleeping.
Very nice. Very good. Oh, we have a question from one of our audience members.
Oh,
Yeah, Mimi De Vera, she said, what made you want to become a nurse? Why not become a doctor?
all right. I get asked this question a lot because I will let you know, when I first started clinicals, it's like I made the mistake of actually showing up to my nursing clinicals in a white coat, just like my nursing professor. And unlike her, I look like a doctor. So I got a whole lot of doctor this, doctor that. And I'm like, who are you talking to? Aren't you the doctor? I'm not even a nurse. I'm a student nurse. And after that, my nursing instructor let me know, don't do that again. Just show up in your white scrubs. And that is it. It's like, keep the bubbly attitude, but just stay in white scrubs. But I actually went through the whole process of actually going to medical school. It's like have my degree from Morehouse College in pre-medicine. I did my MCAT, did a whole lot of different things. I got to my senior year and realized, after talking to a couple of doctors, none of them are happy.
Yeah.
They are really depressed. And yes, the money's great, but it's also a lot of debt you're running into. It's like, and I did the numbers for a couple people because a lot of, it's like males ask me, it's like, hey, why not just go to medical school? And I'm like, I don't have $500,000 that I can devote to going to medical school, nor do I want to spend another 20 years in school. Because they're like, wait, what do you mean 20 years? I said, it's like, yeah, it's 20 years. And they're like, but it's only 4 or 5 years of medical school. It's like, yeah, but you also have your internship. You also have your residency. You also have your certifications. You also have all the other things it takes to become a doctor. Just because you graduate medical school doesn't mean they're going to turn you loose. They're going to want you to actually show you actually know how to keep people alive.
Yes, yes, so true. And it's often, I've heard this a lot and seen it a lot in my career where male nurses have been mistaken for the doctor. And, they always get a good chuckle out of it, but it is quite a stereotype. We often think of males in healthcare as only being physicians. But we have males who are physical therapists, occupational therapists, speech therapists, so many areas in healthcare to work, not only just as a medical doctor. So, it definitely is a misconception that people hold.
Oh, yeah. And a lot of times, even for women that are physicians, it is definitely sobering. Like one of my best friends, it's like, her name is Kim. She is a very tiny woman, maybe about, well, she's not 5 feet. I would say she's shorter than I am, but she is very thin. And when she walks into the room, especially at the VA, people are kind of like, you must be the nurse. And I already know. It's like, she's like, no, I'm actually the doctor. And she will, it's like definitely start imparting knowledge that says, oh, she is the doctor. And the thing is, it's like, it's the same for males. It's like, you have to come in and you don't have to just have pure machismo, but you do need to have a caring attitude. And you need to be able to listen. And that's one of the big differences that separates doctors from nurses. Doctors are great in terms of diagnosis and listen to a certain degree, but they also have a whole litany of other patients that they got to take care of on different floors. So they are running all over the place. As a nurse, yes, I'm running too, but I have a little bit more time to actually listen to your concerns and in some cases translate what the doctor's telling you into something that you can actually understand.
Yes, yes, and that's so true. And that is the definite heart of nursing, is having that compassion, that empathy, and then the advocacy too. We advocate for our patients and we listen to their concerns and needs, and we will communicate that to the physician so that they can ensure they get the best treatments and care that they need.
Oh, yeah.
Yeah, we have another question from an audience member, from Kenya Davis. Um, she asks, in all the areas in nursing you have worked, is there a specialty area that really excites you the most? Well, that's a wonderful question. Thank you, Kenya.
Just to let you know, Kenya's my wife. So
That's why
yeah.
last week my mom was on the show. She was
Okay, I don't feel so bad now. I don't feel so bad. Well, one of the areas of nursing that I really enjoy. Well, there's actually two of them. It's like the first one is what I actually really enjoyed doing for a good 10, 12 years. And that was actually home health. Home health was really fun in terms of you actually got to know your patients, you actually watch them heal and recover. The other is informatics. And that actually is what I'm really passionate about in terms of understanding nursing, because as I even made it through nursing school, I would actually help my instructors in terms of how to understand different programs and the computers. And they're like, you actually know what you're doing on this. And I'm kind of like, well, yeah. It's like before I did this and got on this path in high school, it's like I own an Apple IIc. I learned how to do programming and a whole lot of other things. And they're like, why are you here? And I was like, I like people better than computers. So for the next 20 years, it's like outside of caring for patients, it's like my job was also in terms of helping doctors, physicians, and other nurses learn how to use the computers to actually improve their care and outcomes. Hence why I'm also part of the American Nurse Informatics Society.
Wow, awesome. That's really amazing. Thank you for that question, Kenya. Speaking of informatics in nursing, what do you think about creating a national electronic health record system? What are your thoughts on that?
Wow, I'm actually glad that you asked. That actually brings up one of the conversations that I'm actually having in my graduate school right now for our informatics class in terms of dealing with transient health populations. One of the big things that we're actually talking about is people who are actually living in mobile homes, invisible trucks, and it's like over the road and long haul truckers. They actually have the same healthcare issues, but the dynamics for taking care of them are vastly more complicated. People like to think that, hey, it's like if I just hook you up to a cardiac monitor, you're good to go. Well, imagine you're in a truck and you're traveling in middle America. There is no cell phone reception. Your doctor is hundreds of miles away. And if something goes wrong, where are you going to go? So one of the things that we've been advocating for is for over-the-road truckers to actually have clinics inside major truck stops that are all nationally connected to allow, hey, if they're having an issue, hey, the doctor that you see in Illinois you can jump into a little kiosk, you can talk with him through telemedicine, you can get pictures, live feeds, and everything else. There could be a technician there to try to help in terms of the more complicated aspects to where that coordination care occurs.
Wow. That's awesome. That sounds amazing. And I think with the EHR system, I know there's, some caution about security, but I think it can help to connect people, especially people who are mobile, who are always traveling on the go, people who live in different states, or even people who don't like the healthcare where they're at. Sometimes healthcare where you're at is not the best quality, or they don't have all the specialists that you need. So being able to have all your records, say you go to another state for treatment, they'll have that. So I think that it will help with healthcare, making healthcare more accessible.
Yeah. And a lot of people also think that, okay, it's just transit. It's like, no, it actually applies in some cases to our rural populations, and actually have the conversation in health assessment class in terms of outreach. And I use actually the Houston area as a good example. I'll say it's like, so where do y'all live? And I actually have to put in a disclaimer, please don't give me your address. I do not need to know where you live, because sometimes I wonder about why are you here? Because you're driving almost an hour and a half, 2 hours to get here.
Yeah.
And of course they chuckle and whatnot. And then I say, it's like, so if one of y'all have a medical issue, is there a hospital nearby? And everybody raises their hands, and I ask, how far away is it? Oh, it's like right around the corner, or it's 5-10 minutes away. And I said, that's great. But what happens if you leave Texas?
Yes.
I mean, you leave Houston and you start
Yeah.
traveling outside of Houston. For
Yes.
example, let's say you drive up, I think it's the highway 290 going toward Prairie View. You go to
Mhm.
Waller County. There's not
Yes.
there's not a hospital nearby. You might have to travel upwards of 45 minutes to get somewhere. Or
Wow.
let's say you go past Pasadena. You start getting into, as my wife puts it, the golden triangle of Orange, Port Arthur, and I think Beaumont. But she's probably going to say it's like, no, you got the wrong cities. But it's that area. And I
Yeah.
say it's like, in that area, there's not a lot of healthcare. In some
No.
cases, like for Beaumont and Port Arthur, they actually, if they're a veteran, you actually have to drive to Houston just to get medical care.
Wow.
That can create a huge impact, especially if something goes wrong, like a stroke or a heart attack. The outcomes go down significantly.
Yes. Wow. Wow. Thank you for that. That's good information. I think we do need to have a system like that. We do need to improve access to healthcare. It's so important for this nation. We have so many people that are underserved and that live in areas that just don't have adequate healthcare access. We're going to go to our second commercial break of the evening, but everybody stay tuned for more Pink Table Talk.
Join us for a captivating new series where Lawin sits down with the trailblazers of the music and entertainment world. Discover the stories behind the faces and voices that shape our culture and community.
We will bring you exclusive interviews with industry legends and rising stars. Behind the scenes insights and get a peek into the creative processes and personal journeys. Artists and performers and their upcoming shows and events.
Stay tuned for more updates and sneak peeks. Follow us on social media and subscribe to our channel.
Welcome back, everybody, to Pink Table Talk. Tonight, we're talking with Professor Ed Davis. Before we went on our break, we were talking about improving healthcare access in this nation. So, Professor Davis, my next question to you is, what are the top health issues men face today?
Oddly enough, it's actually the same issues that men have been dealing with for the last century. And that is going to the doctor. And you might, well,
Yeah.
that's not that hard. Well, depending on when you were born and what generation you associate with, it's a lot easier said than done.
Yeah.
A lot of people think, oh, it's boomers that are the hardest ones to actually go to the doctor. Actually, on the contrary, once they know something is wrong, which is the hard part, they're actually pretty adherent when it comes to actually going to the doctor. Now, they are the silent generation in terms of they will let something fester and go on for decades and not think, oh, I might want to get that looked at. This is the same generation where it's kind of like, you know what? It's like I had polio, but I'm still kicking. Or it's like, yeah, it's like I got shrapnel on my chest and my leg and my arm. And yes, I have crippling arthritis, but I'm still running 5 miles a day. But if they have a new ailment, they'll say, it's like, yeah, doc, I'll listen, I'll follow it. And they have a lot of faith in terms of our healthcare practitioners and providing help. But that shift has been changing as the generations get younger. For my generation, it's like we were a little bit more understanding in terms of we're not going to be stoic, but we're still trying to battle that whole masculinity. I'm not going to let nothing happen. I'm going to be Dr. Spock and be unemotional. And if I do have some care, I'll look into it. It's like I might not go to the doctor, but I might get some Robitussin or something to try to cure it. But for a lot of the boomers and millennials, they're a lot more in touch with some of their healthcare concerns. But they're suffering from a paradox. A lot of the generation and times that we've been trying in terms of cut back on smoking, cut back on drug use, they're actually engaging, but not realizing you are smoking. One of the big issues that we're having to translate is vaping. A lot of the younger generation are thinking, oh, vaping is safer than cigarettes.
Right.
And that's not the case. It's actually a worse. And you're actually introducing more chemicals than what you think. And it's actually being marketed toward the young. And they're like, what do you mean marketed? It's like, it's not like tobacco. That smelled horrible. Well, it's the same nicotine, but now that's with chemicals and other flavors that are pleasant for children, like bubblegum, green
Yeah.
apple, strawberry kiwi, and other very childlike flavors that are going to be pleasant for them. But in some cases, because of that pleasantness, it makes you want to engage in it more. So now instead of just a simple couple cigarettes a day, now you're actually smoking an entire pack.
Wow.
Yeah.
Oh, wow. And do you think it's the same with the hookah? I know that's huge here in Houston. People love the hookah.
It's the same thing. It's like for even with hookah, you're still ingesting nicotine into your system.
Wow.
And the thing is, it's not the smoke that's the dangerous part. It is dangerous, but it's the accumulation of nicotine because it gets into your bloodstream and it actually causes cardiovascular issues on a systemic level. It's like not only does it hurt your lungs, it hurts your heart, it hurts your kidneys, it hurts everything. And it's a cumulative effect.
Wow. And why do you think men are often less likely to seek medical care when they're feeling sick or even just for their annual screenings?
This actually boils down to the images that we have when it comes to masculinity. What male masculinity has always been about, it's like, I don't want to show weakness. I don't want to show that I'm hurt. It's like, I'm going to engage in occupations that are going to be dangerous, but I'm going to be able to walk away. If you need a really good example, look on YouTube. It's like, there is a saying, it's called hold my beer. Usually if you see this, hear that expression, someone is about to do something that is probably going to end up really bad, or you're going to be laughing your tail off on their misery. Unfortunately, these activities, especially if you're doing them on a regular basis, can be a bit chronic and unfortunately not helpful in terms of your overall health. It's like falling off a house, although funny, it's pretty painful. It actually hurts a lot. And things like broken bones and internal bleeding and other things you don't want. And for a lot of people, they'll think, oh, I fell off the house. Yes, my bone is sticking through my hand. I'll just shake it off. I'm all right. Are you sure about that? It's like, yeah. It's like, well, you're losing a lot of blood. Nah. It's like, I'll just put a Band-Aid over it. I'll be good. And that actually has translated for a lot of generations in terms of how they deal with health. Now, the younger generation is a lot more aware of it, but they still have that issue on, I don't really want to deal with the doctor. I don't really want to show that weakness. And it is a challenge, but even in my occupation, by being a male nurse, it's showing that it's like, you know what? I don't need to maintain that stereotype. I don't need to show it's like, oh, I'm the biggest dude on the block. You can be the normal guy and still be all right.
Yeah. How do you think the societal view of masculinity impacts men's mental health and them seeking care for mental health?
I'm glad that you asked. Not too long ago, and for most of this year, I was actually doing, it's like a webinar series on men's health within the Adtalem group in terms of issues, in terms of men's health, and some of the things that you can look out for. But now, when it comes to men's health, men suffer from depression more than a lot of people are aware of. Due to that, oh, I'm not going to show any weakness. No, I'm going to be here all by myself. I'm not going to say it's like I have a problem. It translates into a worsening spiral of depression. And in many cases, men are becoming the end result of that depression, working towards suicide or suicidal ideations.
Yes. And I hear the statistics, it says that men complete suicide more often than women. Is that true? And what do you think is the cause behind that?
Isolation. I can say without a doubt, through my own experience, it's like when you are by yourself and you are in a bubble, the internet is not your friend. The internet can actually make things much, much worse for you and can make that spiral even deeper.
Yes.
And you might be thinking, well, you seem like a pretty upbeat guy. You got a whole lot going on with you. Well, not really. It's like I'm not sure my second marriage. My first wife passed away, unfortunately.
Yeah.
Fortunately, I was able to find another person who's been fantastic. But that time in between, the grief, depression, it wasn't fun. It's like alcohol was a rather good friend, unfortunately, and it can make that depression even worse. And when you think, hey, it's like I'm not an old person. It's like I know the internet. It's like, hey, I can probably reach out. Well, unfortunately, internet can also it's like be a echo chamber. If you're feeling down, it's going to throw a lot of images and content where it's going to make you feel even worse. It's going to give you images where it feels like everybody's got it all together. Everybody is perfect, and it's going to make you feel horrible.
Yes, that's so true. I have definitely read statistics about teenagers, the effect social media and the internet has on teenagers. But I never thought about how it would affect the men or like older men. So thank you for giving us that insight. Um, yes. And also I wanted to know, what are some signs that a male may be struggling emotionally, but trying to hide it?
Well, it's actually the complete opposite of women. For a lot of women, when they get angry, and we're going to use you, Dr. Dillon, when you get angry and you are ticked off at somebody, what do?
Well, I guess I yell or scream.
You vocalize. You
let
must
it
say,
out.
I am not happy with you. For men, we do the exact opposite. We'll usually say, I'm fine. I'm good. And we will sit there and not do a darn thing about it and just let it go. And it just eats at us. Unfortunately, that internalization isn't really good for you. Even though men might think, man, I don't really need friends. I don't really need nobody. We're all social creatures. We need to talk. We need to emote. We need those pressure points to bring us down. For women, it can be a lot of, hey, we can do a task. We can get together. We can go have fun. For men, it's a lot more action. You want to be able to accomplish something that works. So for a lot of times, therapy involves doing very task related activities like having a man shed where you can build stuff, you can work on something. And a lot of men, they do that in terms of doing car restorations or joining motorcycle groups, or it's like doing things to where it's like, hey, it's us, I have a relatable group, and we talk. And you'll see this very often, especially for people suffering from PTSD, or they get with veterans groups. The VFW is a good example in terms of not social isolation, but getting people to actually open up around peers that have similar experiences.
That's very interesting. I do like the idea of the man shed, or at least them having like a space to develop a hobby. I think that's such a great way to kind of, relieve stress. And I find that it's very therapeutic. I know a lot of my brothers, they love to work with their hands and they love to do different projects. My one brother, he loves to build racing cars. And, I always kept wondering, like, why every day he gets up to do that? But because I wouldn't want to work with no oil and grease and all that, but he loves it. He absolutely loves it,
Well, it's the same thing as when we were little kids. Boys usually like playing in the mud and basically coming home smelling like god awful because it's fun. And we work with our hands and we get to do stuff that basically terrorizes the opposite sex. As you get older, the same thing occurs. We don't like to terrorize you, but we do like getting our hands dirty and coming home a bit smelly.
Yes. That's so true. And speaking of family and friends, how can family and friends support the men in their lives to open up about their mental health and their needs?
This was actually a little unique. A lot of women will think, well, let me just hit it head on. Let me just talk to you. Well, that's not the right approach to take with a lot of men. Basically, it's like, just say, it's like, hey, if you want to talk, I'm here. You'd be surprised how often, once you come at it from that standpoint, people will open up. It's like saying, hey, it's like, I'm not going to tell you what to do, but here are your options that are available. Or if you don't like those options, what would work for you? It's like, it's not to say that it's like you're telling them what to do and how to handle this, but you're giving them that avenue in terms of, hey, here's something we can do to start that conversation, keep the communication lines going, and engaging.
Yeah, that's good. That's very good. I find that for women, we love to talk. We'll talk to our friends, sister, anybody, and even now social media has become an outlet for us to express ourselves. But I find that men do tend to be a little more on the quieter side. Any tips for getting them to open up and talk? Is there best time or setting? Especially for those who are dealing with loved ones with mental health or substance abuse.
Basically, just say you're available. Make yourself available. If they say it's like, hey, you got a second? All right, I'm here. Sit down, just be quiet, do your own thing, but make yourself, hey, whenever you want to start this up, I'm right here. You can be doing your own thing, looking at your phone, not too intently, but hey, just casually, just going through. Hey, I feel like talking. You'd be surprised how quickly men will open up.
Wow.
But if you come in there and say, look, you need to talk about this, I will be like, hey, no, I don't need to talk about this. You need to get the heck up off of me. But just saying, it's like, I'm here. I'm available to talk. Hey, this is a good day. This is a bad day. And just going from there.
That's good. That's good. Great advice. Thank you. And now this is a little bit of a funny question, but there's a saying called the man flu.
The man flu. Okay.
And so a lot of wives complain about the husbands in their lives who, if they get even a little cough, a little sniffles, they act like they're at death's door.
I would agree with you. It's like my wife would say, it's like, I am a horrible sick person. She says, it's like, I don't want to take anything. I just want to sit there and be a bump in the log. I'm kind of like, yeah, I don't really want to take this stuff, but it's like, I will eventually. And yes, you might hound me on it, but I'll listen to you and finally take something when you walk away and you aren't looking. And then it's like, I'll feel a little bit better.
Mm-hmm. Yes, and so I definitely do see a lot of memes and, a lot of social media chatter, wives, complaining like, oh, he just has a cough and he's been on the couch for the whole week.
Yeah.
Yeah.
I'm sick. It's like, you're not going to ask me for too much. I'm just going to be like, you know what? Let me run with this.
Oh, very good. Very funny. But, I think everybody just presents differently when they get sick, but I always do love those memes, it's always some fun.
And then, of course, it's like you do have the sect of men who I will definitely be on death's door, but I will continue doing whatever the heck I'm doing. Hey, it's like, yes, I've completely clogged up. I'm dizzy. But you know what? I still got to cut the lawn.
Yes. And that was my father. He was a military man. He was in the Air Force, a strong, formidable man, but he did have a chronic illness. And we would tell him, Dad, just sit down. We'll go to the store. We'll take care of this. We'll do, whatever around the house. No, I'm fine. I can do it myself. And that was his attitude. Or he'll say, okay, we'll tell him, you don't have to go to the store. I'll go get the groceries or whatever. Next thing you know, you hear the door slam. He already left.
Yep. That is an example of the old school generation. I will suffer in silence and not let nobody know.
Yes. And so we would just be shaking our head at him like, Dad, you're making yourself worse. But he had to do it. And I think that was part of that autonomy that he wanted. I don't think, he didn't want to be seen as weak. And, I feel that generation really had that sense of what it meant to be the household, the male of the house, to be that provider, that breadwinner, to be that strong presence in the home. And so I think that is where that was coming from.
And it's like, it is one of those role models that, hey, it's like from back in the day in the early 30s and 40s, which a lot of our parents are. It's like the role model was it's like, I'm the man, I take care of the house, I can't show any weakness. It's like I've got to be the central pillar. It's like the little lady's counting on me. So I've got to be the one to make sure this house stays and it's like stays together. Unfortunately, it's like they don't realize like, your wife was actually keeping your house together while you were doing whatever you needed to. In many cases, like she was raising your kids, she was helping pay the bills, she was making a meal for you. It's like that house that you think depended upon you was actually dependent upon her too.
Yes, it's so true. It's so true. Well, we're going to take our last commercial break for the evening, but everybody stay tuned for more Pink Table Talk with Professor Davis.
For divorce and family law in Texas, Liggett Dizzen Law Firm PC will guide you every step of the way.
From initial consultation to detailed review of your case and strategic planning.
We'll sit with you during negotiations or mediations, and represent you in court.
Whether it is a family law, estate planning, or immigration, we will be there to guide through the final steps.
So, leave your legal matters behind you and embrace your future.
You can contact Liggett Dizzen Law Firm PC at 346-5454-346 or visit DizzenLawFirm.com.
Welcome back, everybody, to Pink Table Talk. We have a question from our audience member, Mimi DeVera, one of our devoted fans. She is asking Professor Davis, did you really plan to be a professor? If yes, why?
Oddly enough, it kind of fell into my lap. It's like after I finished graduate school and I was trying to figure out what I wanted to do, I started looking around. A lot of people were kind of like, all right, you got a master's. Why you still want to just take care of people? I enjoy doing it. And then after a point, they were kind of like, you're kind of telling us how to run stuff and teaching us on how to work EMRs. And you're really good at teaching our new nurses how to get the job done. Why aren't you teaching? Huh? Why aren't you teaching? Okay, I've never thought about teaching. So then I applied for a job and they said, it's like, hey, you're pretty good at this. You want to come teach? It's like, right now we don't have any positions in terms of lecture, but in terms of the basic skills like vital signs and doing Foley's, you want to try that out in our lab and simulation. And from there, I started doing that and students were kind of like, you're really good at helping us understand this stuff. And then they were like, hey, you want to teach lecture? And I was like, okay, sure, I'll teach a lecture. And from there, it's like, I haven't looked back.
Yes. Wow, that's wonderful. I feel that teaching, it truly is a calling. Not everybody can teach, but I feel that you teach really well and you're also a mentor and role model for your students. And so I think that this is a perfect fit for you. And I love to see what you're going to come down the pipeline with the informatics. Probably create a really awesome program for nursing.
I've been asked, and I'm kind of like, no, I don't need to do all that. But my students do enjoy the little bit of HTML coding that I put in the announcements. They're like, your announcements look a lot different from the rest of the faculty. Well, I know how to code.
Yeah, that's awesome. That's an awesome skill to have. Going back to men's health, what does a healthy man look like to you in this day and age?
He knows how to ask for help.
Yes.
He doesn't have to say, oh, I need help, but he definitely knows, you know what? It's like, I am over my breath. I don't know what to do next. You don't have to be ashamed. You can say, it's like, you know what? Let me call in some help. Or one of my favorites, and this is going to go back into it's like recent history, but that whole Aquaman thing. Brother at the dock was kind of like, man, I'm over my hat. Let me throw up my hat and get some help. That's what the modern man is about. It's like, you know what? I can't handle this alone. I need somebody to come in, and some dude comes swimming across the river to come help you. That's how good healthy male relationships are. If you need help, you got a crew. You got people that will definitely step up and help you out. It's not a sign of weakness to ask for help.
Yes, it's so true. It's very true. And are there any particular screenings that males should get, and at what ages should they get these health screenings?
Generally, it's like one of the big things that I actually have to encourage my males, especially that are it's like starting to get up there in age, is prostate screenings.
Yes, yes.
One of the things that I have to emphasize is the fact of, yes, it's a prostate screening. Yes, it's not going to be fun, but the old school way of doing a prostate check is not what you think it is. New technology and new techniques, now all we have to do is just draw blood.
Oh, wow.
Yeah, it's called a PSA screening. Basically, we draw a little bit of blood, we check your levels. If your levels are high, then we do further testing, like let's say a digital examination. But if your levels are high, we'll tell you, hey, your levels are good. Come back in a couple of years and we'll check again.
Yes, yes. I think that there is a lot of fear around those types of exams. I feel that they don't want to be, touched or probed.
Yep. And it's like a lot of men, it's like being a fact of women are becoming doctors a lot more often.
Yes.
Some males do have some issues when dealing with a female physician in terms of disrobing, looking at different parts of their body, and they're kind of like, it's like, you know what, doc, you're great, but I'm not dropping my pants for you. It's like there's a line I'm just not going to cross. And this is where it's like for a lot of times that switching of roles where, hey, the nurse might be more, it's like approachable than the physician in terms of getting the answers and being relatable to the patient.
Yes, it's so true. You said something funny when you mentioned the dropping the pants. I remember as a new grad nurse, and I had a male patient, and I went in to give him his bed bath, and he let me wipe everything down.
Yeah.
And he kept his underwear on, and he said, "Can I have one of those washcloths?" So he took it and hurried up and scrubbed inside. And gave it right back because he did not. That was a no-go. So.
And it's the same way for male nurses working in, like, let's say labor and delivery. When I was a student nurse and I had to do my L&D, pretty much it's like, imagine me, but with more hair, a piercing in the eyebrow, and a lot more muscles. I walk into the room, it's like, hello, my name is Ed Davis. Get out. So it's like after about the 10th room, it's like the charge nurse was kind of like, why are you back at the nurse's station? Everybody done kicked me out the room.
Yeah.
Everybody? It's like, It's like, was it the patient who kicked you out? No, it was their significant other that had an issue. They didn't want me, it's like looking down at their woman's genitalia. So after that point, then it was kind of like, you know what? You seem pretty knowledgeable. How about you come help us out in labor and delivery surgery? And I was like, what, we gonna cut up people? Well, not exactly. It's like, we don't cut up people. We actually do something called a C-section. It's like, oh yeah, I've seen those. So then you like, as a male nurse in L&D, you saw a lot of C-sections. You saw a lot of those surgeries or a spinal tap. And you realize, hey, this is a delicate procedure where a lot of things can go wrong. And you get that appreciation and different perspective in terms of the career itself.
Yes, it's so true. It's so funny though. I'm hoping in the future we can kind of get over these gender stereotypes and gender fears because we have some really great quality male nurses who do have, passion for labor delivery, for all areas of nursing. And so I'm hoping that we can continue to grow more men in the field.
And they're growing. One of my Morehouse brothers, who actually was supposed to be coming in and talking to the men of nursing, his name is C.T. Helm, or I call him Cardetrius. He's actually working at, I think, Memorial Hermann in the neuro floor.
Oh, nice, very nice. That's wonderful. And so what would be your words of advice to those wanting a career in health, for the men out there who may be in nursing? What words of advice and wisdom can you give to them?
Ooh, I love this. So one of the things, and this is actually something my wife actually taught me and it's like told me about, and something that's like that I want to pass on. As you get through the field, you need to start developing your plan. Once you graduate and you get your NCLEX or pass your NCLEX, you need to develop a 1, 3, 5, and 10-year plan on what you want. It doesn't mean you're going to have it happen, but you definitely need to develop that plan along with having a mentor and a coach.
Yes.
They can be together, but you really do need to have a mentor and a coach to help you through your career because 5 years goes by real quickly in nursing.
Yeah.
And if you don't have a plan as to what you want to do, you could be stuck working on a floor for 20 years and not even realize it.
Yeah.
Not to say nothing's wrong with working a hospital floor, but it is not a job you want to do for a really long time. It is brutal on the joints, the back, the workplace violence, and the stress.
Yeah. Yeah, so true. I definitely, I have 2 herniated discs and feet numbness so from nursing. So
I can understand. It's like I ruptured an Achilles heel. It's like when I was on the floor.
I have my battle scars. But thank you so much. And so what's coming down the pipe for you? Any projects, speaking engagements? What's next for Professor David?
Well, funny that you ask. It's like I just finished up a nurse faculty fellowship with Chamberlain, and it's like I'm working on a poster presentation for the American Nurse Informatics Society in terms of teaching faculty on how to use technology.
Wow, wonderful, wonderful. That's awesome. Thank you so much again for coming on the show tonight. Thank you for talking to us about men in nursing, your career and background, and all the wonderful things that you have achieved. And thank you for the work you do with men in nursing. We need more males in the nursing field. And so I just thank you so much and good luck on your doctoral work.
Thank you.
Well, that's it for the show for tonight, everybody. Thank you for tuning in. Be sure to watch us next week as we talk about the state of healthcare in Houston and how to choose the right provider for your health care. So have a good night, everybody, and I will see you all next week. Bye-bye.
See ya.